I hope everyone's having a great evening so far. Um, just a few housekeeping notes before we begin. We try to keep these deep dive webinars as interactive as possible. So if possible, that you are able to do so, please turn your cameras on. We will have a breakout room within the first 10 minutes of this session. And I hope you really enjoy this deep dive. We have our presenter this evening, which is Dr. Gary Turnbull, and he is the co-director, veterinarian and co-director at the Lincoln Institute. Very welcome to Dr. Turnbull. Over to you.
Thanks, Denise, and welcome everybody. It's lovely to see you all.
Okay. Just getting a few more coming in. Feel free to begin at any time.
Okay. Thanks, Denise. Well, just my background very briefly. I'm a director or co-director of the Lincoln Institute of Veterinary Business based down here in Australia. I know you have met my good friend and colleague, Dr. Michael Powell. He and I share very similar backgrounds. I graduated from the University of Sydney way back in 1995, probably before a bunch of you were even born. Which sort of speaks to hopefully the level of wisdom I can share. I spent about 25 years in companion animal practice and 21 years as an owner of a companion animal veterinary practice on the east coast of Australia. And it was about 2012 that my focus began to shift a little bit. Whilst I was still practicing clinically, I became increasingly interested in leadership development, personal leadership, organizational leadership, business acumen within our profession, and non-clinical skills development. And over a period of about a decade, I transitioned out of practice and into this role full time. And my passion now very much is about the amazing caregivers like yourselves who are at the coalface delivering veterinary health care to the general public day in and day out, whether that be in a companion animal and or production setting. And really our big why at Lincoln, as you're probably gathering, is to improve the day-to-day experience for veterinary professionals such that we can enjoy greater personal satisfaction, professional fulfillment, and career longevity in what can be, and in fact should be, an amazing professional experience. So that's really my background. I'm certainly hoping to deliver some value to you over the next 60 minutes as we explore the topic of managing difficult clients, angry and emotional clients, is where we're going to focus. And I guess there's three outcomes that we want to achieve in these difficult interactions. Number one is the best outcome for the client. Number two is the best outcome for the practice. And most importantly of all, because these do weigh heavily on us, is the best outcome for ourselves. And we'll talk about the emotional impact of these difficult interactions, because they do weigh heavily on us. I certainly know that firsthand. Okay, so I'm just going to share my screen. Just to confirm, Denise, that's appearing. Everyone can see that. Great. Thank you very much. So what I'd like to do, though, just to kick things off, if you wouldn't mind, we're just going to utilize the chat box. I frequently do a quick quiz, both in virtual and live settings. And I just find this a fascinating inquiry, and hopefully highlights the reason why we exist and do the work that we do here at Lincoln. So the first question I have for you: I pursued a career in the veterinary profession primarily because I wanted to either one, work with people, two, work with animals, or three, have a career in sales. If everyone could just punch into the chat box a 1, 2, or 3. People are gross. Okay. Ones and twos. Looks like a fairly, so far, thank you everyone, fairly overwhelming response to number two. And I don't see any threes at all. Just to share with you, I have I don't know how many thousands of colleagues that I've asked this question. I don't know how many, but it would be several thousand. I have had one single veterinarian answer three and say career in sales. And it was interesting, this was in a live audience, and he felt compelled to come up to me at the end of the presentation and say, Gary, I wasn't being smart or facetious. I actually had a career in sales before I became a veterinarian. I was a mature age student and actually had a passion for selling, and then decided I wanted to move into an animal welfare pathway. So one single person has said career in sales. These results here are fairly predictable and repeatable, and probably no surprise to you. And that is that I find 90 to 95% of veterinarians and veterinary professionals will say, I pursued this career because I wanted to work with animals. And I don't think there's any surprises there. Okay, here's question number two. Thinking about the typical stress and frustrations I experience day to day, they tend to relate more to my work with either one, animals, and by that, of course, we mean our patients, or two, people. And by people, that means our clients and our colleagues, and/or our colleagues. Lots of twos. Okay, bit of one and two, Victoria, thanks. All right. So there is a disconnect here, which is probably very obvious, and that is that most of us enter this profession out of that passion for animals and animal welfare. We naively think that by becoming a veterinarian, we're going to work with animals, which we do, of course. What nobody tells us is that kind of well-hidden secret that you're actually going to spend most of your days interacting and working with people by way of the general public and your work colleagues. And sadly, when we look at undergraduate veterinary education, there is very little time to dedicate towards the non-clinical skills that really help us thrive with these interpersonal interactions. And that's because there is so much content, so much technical or clinical content that we need to learn. And the other challenge when speaking with universities is that try convincing a student that's important when they're at university. And I can certainly cast my mind back to a sort of final year student and worrying about, can I preg test a cow? Can I spay a cat? Can I palpate a mass in an abdomen? And interpersonal interactions were not even on my conscious radar. It was not even something that had crossed my mind. So this is the disconnect, and it's certainly the reason why we've created the Leading Edge program, which I know you're all experiencing now, and adding in some of these sort of deeper dive webinars as well. Okay. I just want to share some research with you. I'm sure, I know Michael will have shared some data. This particular result here comes from Australia and New Zealand. However, we've conducted two studies, one in 2018 and one in 2021. Over 2,200 veterinarians across the two studies. US and Canada were included in one of those. And the results were fairly repeatable across both studies. And there's just two points I want to highlight. I routinely encounter anger, abuse, or deliberate emotional manipulation from clients relating to the cost of veterinary care. You can see there well over 50% of respondents answering in the affirmative. And I point out that this statement relates only to a confrontational interaction based on the cost of veterinary care. There's a host of other reasons why we might be having a difficult conversation or experiencing a confrontational client as well. So this is kind of just a subset thereof. Probably even more alarming please quantify approximately how often this anger, abuse, or deliberate emotional manipulation from clients relating to the cost of veterinary care occurs in the course of your work. And you can see there the clear winner, at least weekly. At least weekly. So this is a common occurrence. Again, while this is Australia and New Zealand, we repeated this across 12 countries and the results were fairly similar. So what we'd like to do now is just to explore this together. So what I'm going to do in a moment, I'm going to ask Denise to create breakout rooms. We're going to send you off just for 3 minutes into pairs to meet a colleague that you might already know, meet a colleague you may not know, which would be kind of cool. And I want you to share with each other 3 things. Number 1, how frequently do you face difficult client interactions? Emotional clients, angry clients, abusive clients, manipulative clients? That's question number 1, is how often do you, what would be rough or typical frequency for you? Number 2, how does this make you feel when you're facing a confrontational client interaction? What emotional response comes up for you? How does it make you feel? And number 3, what do you find most challenging? It'd be really good to hear just some insight into how often does it occur, how does it make you feel, and what's most challenging. Then hopefully by the end of the hour, I will have provided you with some skills and strategies to help, number 1, help make it a little less uncomfortable and help make you feel a little bit more confident. So Denise, if we're okay, we'll send you off. Please follow the prompts on your screen. Then, depending on numbers, there might be one group of 3 if we've got odd numbers. We'll see you back in 3 minutes. Thanks, Denise.
Yep.
Okay. Welcome back, everybody. I'm going to ask, would someone feel happy to unmute and just share their experience? If someone's brave and courageous, I'd love to hear from someone in the audience. How often does this happen for you? How does it make you feel? What do you find most challenging? If we've got someone who'd be happy to share.
I'll be brave
Thank you.
and chime in if you can hear me.
Thanks, Caitlin. We can hear you.
Okay, I think we kind of skipped over the second question, although it came up in the discussion. Interestingly, our group was 2 of us are doing very part-time relief work.
Right.
And the third in our group was a brand new baby vet, just graduated a month ago. So the 2 of us who do locuming said that because we're locuming, we don't encounter a lot of difficult clients, but I would say on average, there is at least 1 in any given day. And that rolled right into this third part of the question, which is what's most challenging. And that is that person, that individual, whoever that challenging individual is, seems to take over the day. When you go home at the end of the day, you don't remember. If you've seen 20 patients, you don't remember the 19 that were good or great. You remember that one individual that sort of sucked the life out of you. And that's the hardest part, is moving past that individual. Yeah.
Caitlin, thank you for sharing that. It's something that let's just address now. It's within the content of this presentation. And we experience that all the time at an individual level and a team level. You could have 30 or 40, or depending on the size of the practice, 100 people walk through your door and they are respectful and they're appreciative and they have nothing but praise for the work that you do. And it only takes that one to really take the edge off the day. In fact, to almost ruin the day. And as you say, Caitlin, that's the one that we go home. If we're prone to rumination at all, that's the one we're going to ruminate on. And so, and I've wondered for a long time why that was. And I read some research recently that really spelled it out nicely. And it goes along the line of think of in a confrontational situation, we have an amygdala response. We have a limbic or emotional response, and it's reflexive. We don't have control over it. It's from from a evolutionary psychology point of view, it's that fight, flight, freeze, or response. It's there to protect us in the face of life-threatening situations. And sadly, our primitive brains haven't caught up to the modern world. So often we're having a reflexive response to a stimulus that is not life-threatening at all, but creates the physiological and emotional responses in line with that. So it's like, think of it like a red alert system in the brain. And it's profound because of the emotional and physiological response it creates, which we're all very, very familiar with. What does not exist is an equivalent green alert system. So we don't have a reflexive positive response to those positive interactions. In fact, they just tend to feel more like neutral interactions. And that's why there's this imbalance. One is creating a very significant emotional and physiological reaction. The positive, on the other hand, it's not that there's no reaction at all. There is, because with positive interactions, we do release oxytocin, and that has a positive response amongst some other neurochemistry as well, but nowhere near the impact of cortisol and adrenaline. And when we think about positive versus negative interactions, the other thing is cortisol lasts in our system for about 4 times longer than oxytocin does. The oxytocin splash is quick and it's gone. Cortisol lasts around 4 hours. So what I'm going to do, and I'll flag it when we get there, I'm going to share a specific strategy to help address that exact situation. So what can you do in that transition from work to home in order to help us quarantine work and enjoy good work-life balance and personal satisfaction when you get to the end of the day and you've had those 20 neutral to positives and that 1 negative, and all you're thinking about is the negative? What can you do? And I'll share a specific, in a moment, a specific technique that's been developed by an Australian psychologist by the name of Dr. Adam Fraser, and there's some really cool work that he's done. Okay, so moving into the presentation proper. What I'm going to share with you is this approach to confrontational clients through the acronym DEALT, D-E-A-L-T. This is covered more superficially in one of the leading edge modules. So when you get to it, this won't be unfamiliar. We're just taking a bit of a deeper dive into things in this particular webinar. And as I mentioned before, if we think about the outcome, number one, we want to diffuse a potentially volatile situation. Number two, we want to achieve a positive outcome for your client and for the practice. And number three, we want to minimize the impact, the deleterious impact on yourself, so that you can bounce back faster. In other words, increase your resilience to these interactions, these situations. So what I'm going to do now is I'm just going to work through DEALT, and then time permitting at the end, we'll do a bit of Q&A so we can answer any outstanding questions that might be. So the first one, D, actually covers 2 things. Don't react and don't accept abuse. Don't react, don't accept abuse. Now, in terms of not accepting abuse, what I want to share with you is an advanced communication technique to manage difficult or confrontational behavior, and it's called an I message. And this allows you to address uncooperative behavior without pointing the finger at your client, without putting them on the defensive. So as you can see there from what I've shared, it starts with when you, and then describe the objectionable behavior that you're observing, that you're experiencing. I feel the feeling that's been evoked because, and then the effect that it's having. So as an example, when you raise your voice and speak over me, I feel disrespected because I am unable to share my perspective. I feel because. And the when you at the beginning of the statement provides a subtle reminder that you are still operating from their frame of reference, not your own. And this creates an atmosphere of respect as your reaction is based on something that they produced. So I feel because, and it just helps to manage their behavioral responses without putting them on the defensive or you pointing the finger at them. Okay. I also mentioned don't react. So this is going back to what we spoke about before in response to Caitlin's commentary, and that is this lasting impact it has. And that is because in the face of threat, we have the amygdala hijack, fight, flight, freeze, that red alert system. Now, when we are heightened emotionally, we are not going to be able to bring our A game to a difficult or complex interaction. So if you're feeling that emotional response, feeling offended, feeling on the defensive, feeling disrespected, that's not the time to have the conversation. And in fact, self-regulation is all about building in time to manage the emotional response. Our behavior is a balance between the limbic brain, which is emotionally driven, and our neocortical brain, which is kind of a logical thinking and reasoning. And so we talk about specific actions you can take to dampen down that emotional limbic response. And that's really, again, what self-regulation is all about. In the famous words of a psychologist and physician, Viktor Frankl, between stimulus and response is the freedom to act. And this is one of the unique elements of the human condition. We're the only species that really has this opportunity to take the time to manage our response to stimulus rather than be reflexive. Now, I mentioned a specific technique that you could use, being the third space, again, in response to the comments that were presented earlier. So Dr. Adam Fraser, if you were to just search him, a fantastic YouTube presentation will come up at the top of your Google search, about a 23-minute presentation on the work that he's been doing on what he calls the third space. The basis of his research was the transition from workplace to home and home to workplace. In recognition that if we have that bad day at work, if we have that one interaction that really ruins the day, how do we prevent ourselves from taking that home with us? And equally, if there are challenges at home or stressful situations at home, how do we transition to bring our A game to work, which of course is what our clients and our colleagues need. So that was the context of the research was based on. But the third space can be utilized in a much more micro setting. An example might be transitioning from a euthanasia to a puppy or kitten vaccination, or vice versa, or transitioning from a consultation with a client to a difficult conversation with a colleague. We have all of these moments of transition in our day, and with each transition, we can use this technique of the third space. And there are 3 steps within the third space. First is reflect, the second is rest, and the third is reset. Now, by reflect, the idea is, regardless of the context, maybe it's my day was ruined by this bad client, but now I'm going to go home and I want to bring my A game for my life partner and kids, my family. Or it might be that I'm moving from euthanasia to puppy vaccination. So now I've got to completely change my demeanor. And by reflect, this first step is reflecting through an optimistic lens, because unfortunately us humans are hardwired when we reflect to think about the negative. So it's important to do this through an optimistic lens. And to be even more granular, ask yourself 3 questions, or one of 3 questions. Reflecting on the day or reflecting on the most recent interaction, depending on the context. Number 1 is, what did you do well? Ask yourself, what did I do well? Now, in a day where we've had that miserable client, 99% of the day we've probably done things well. So let's find something that we did well. Number 2, how did I contribute? How did I contribute positively? And number 3, where did I improve? So what did you do well? Or what did I do well? How did I contribute? And where did I improve? That's number 1. Step 2 is rest. Now, rest might be most of that drive or commute from workplace to home. Rest might be, I've just walked out of a euthanasia, I'm walking into a consult room, and I'm going to spend a minute in rest before I call in the next client. Now, rest will be different for different people. Again, depending on context, it might be listening to some music that works well for you. It might be playing a guided meditation, or in that sort of micro setting of, I've got a minute now to rest. A couple of valuable self-regulation strategies. Number 1 is just to utilize panoramic vision. By panoramic vision, can I ask you just to do this now? So what I want you to do is just dilate your pupils to take in as much peripheral vision as you can. Just let your eyes relax and expand your field, your visual field. Just that simple technique will suppress sympathetic drive and increase your rest and digest parasympathetic tone. Quick, simple, you can do that just for 5 to 10 seconds. A second technique, and again, I'm going to ask you to just have a go at this in a moment, is what's called a physiologic sigh. And a physiologic sigh, again, can be done very quickly, uses 3 steps. The first step is to inhale through your nose, just a normal, nice, large inhale. Then, after a second break, take a little bit more air in to completely expand your lungs, and then slowly exhale through pursed lips. So it's a normal breath in through the nose, hold it for 1 second, take in a little bit more through the nose, and then slowly exhale. If I could ask everybody just to try that technique on 3. 1, 2, 3. Just that technique alone helps to suppress sympathetic tone, suppress cortisol levels. And you can repeat that multiple times. And then the most simple form of self-regulation, if you feel like I don't have much time to build in here and I'm feeling somewhat emotionally overwhelmed, then you can just count. just count, because the limbic brain can't count. It is the neocortical, the logical reasoning brain that counts, and it helps to suppress that amygdala hijack. Just counting. So there is a range of strategies available in order to prepare yourself for a more challenging interaction. Okay, the second, E. Again, there's two points here. Number one is extricate, if necessary. That may not be necessary. And empathize. Really importantly, difficult conversations are not a team sport. We do not want spectators. And so having privacy helps to remove distractions, and it allows you to be fully present. We don't want to be having this conversation across a busy waiting room, or across a reception desk, or if it's a colleague in certain circumstances, or even a client maybe in a busy treatment room. So that's number one, is you need to be fully present, and we want to avoid distractions. Number two is recognizing that your counterpart's their deepest need is to be understood. Now, by understood, both how they feel, which is empathy, and what they're thinking, or what's their truth, which is perspective taking. So what we want to do as we begin this interaction is to demonstrate empathy, show that we're working hard to understand how they feel, and then transition straight. That will open the door to transition into perspective taking, really understanding their truth. And there's a technique, a really simple and valuable communication technique that you can use to demonstrate empathy, and it's called a label. And you can label anything you can detect. So the words that they speak, their body language, their tone of voice, silences, anything that you can interpret, you can place a label on. And the good thing about labels is there's no harm if you get it wrong, because your counterpart's desire to be understood far outweighs any negative connotation that comes from missing the mark. So let me give you an example here. An example would be, I can see you are upset by this. So a label is, I can see, or it looks like, or it sounds like, and then just follow with whatever you're interpreting, what's in front of you. And I said, if you get it wrong, there's no harm done. Your counterpart will recalibrate for you. So an example might be, you might say, it sounds like what I've said has upset you. No, I'm not upset. I'm just confused. So if you get the label wrong, your counterpart will recalibrate for you. And then you can move straight into perspective taking. Can I take some time with you to understand what has happened? Or would it be inconvenient? We'll finish up with no-oriented questions. Would it be inconvenient if we talk about this more deeply right now? So step one, a label, I can see, or it looks like, it seems like, it sounds like. The one thing, and it's intuitive and obvious, if someone's face is red and they're perspiring and their voice is raised and their hands are flying around and they're clearly angry, then probably best not to say, it looks like this has offended you or this has upset you. We can move to I can see, because we're going to be pretty sure we're on the mark there. So just I said, probably intuitive, and you do it automatically. Okay, label to demonstrate empathy. Ask to understand what has happened, which moves into perspective taking. Now, there is an important point too. When we are in conflict with other people, in any setting, there are two truths, yours and theirs. So your version of the truth is your perspective, all the facts as you understand it. and then they have theirs, and that is going to be different to yours. If they weren't different, you wouldn't be in conflict. What we tend to do in conflict is we tend to default to looking for what's wrong. So when we disagree with somebody's feedback, we tend to be thinking, at least maybe not articulating it, but thinking that's wrong. Now, if we can shift the mindset to that's different, it's very, very productive, because the goal here is not necessarily to agree with the client. We may not agree with them. In fact, chances are we're not going to agree with them. However, we must understand how their truth makes sense for them. So we want to explore this with curiosity. And the more we can think that's different rather than that's wrong, the more curious we can be and more generous in our thinking and less judgmental as well. Okay, so then we move on to A. And A represents ask, and I've put in brackets, good questions. And the reason why I put in brackets good is because my experience personally, and certainly what I've seen of hundreds to thousands of colleagues, is we're not necessarily wired to ask good questions. And what I mean by that is we have a propensity for asking closed questions. Closed questions, of course, yield a yes or no answer, as opposed to asking open questions. And I think there's a number of reasons why we do that. I think number one is often we're busy. So a yes or no is really attractive because it saves time. Secondly, often we don't really want to have our thinking challenge. We're really just looking for agreement. And that's much easier to come by when we ask a yes/no question. So I think there's a number of reasons for it. Most importantly, open and closed questions have their place. Closed questions are good for confirming factual information quickly. An example might be, were you at reception when the client started making the complaint? No, I wasn't. Great, that's really valuable because now I don't need to continue that line of inquiry. You weren't even there. Another example might be with an aggrieved client might be, did you receive a call from us twice daily? So we just want to confirm factual information. We also, though, and tend to get a lot more value out of open questions. Who, what, where, how, because it gets inside the mind of your counterpart. An example might be, instead of, did you appreciate how sick Fluffy was? Now, whether you get a yes or a no, well, if you get a yes, you have no idea if they really did understand how serious things were or not. It's just their belief of what they know. So a better question would be, what was your understanding of the severity of the illness Fluffy was suffering? So look for places where you can replace a closed question with an open question. You'll also note there I've said beware of why. The reason is that the question why is intrinsically accusatory. It suggests there is a right answer and they haven't got it. So it will put people in a defensive posture. So instead of asking, why did you do that? Why do you say that? Ask what makes or what made. What makes you say that? And it just helps avoiding defensive reactions for people. So open questions where you can, closed questions where you just need to confirm factual information quickly and use what makes or what made, depending on the tense or the context, rather than why. And then there is one particular question that is particularly powerful. In the face of heightened emotional states, people will tend to exaggerate and or embellish. So sometimes you'll hear these sweeping statements, and when you hear this, you feel compelled to go on the defensive. The example I'm giving here is, well, my pet has suffered unnecessarily at the hands of your incompetent vet, which is this kind of embellished and exaggerated statement. So rather than saying, well, hang on a minute, no, our vets aren't incompetent, all of our vets go through rigorous training, and rather than going on the defensive, simply say, I'm sorry, with an upward inflection, I'm sorry, and then repeat the last 1 to 5 words that they spoke. I'm sorry, incompetent vet. What mirrors do, well, number one, they demonstrate that you're listening because you've mirrored what your counterpart said. They also avoid you asking direct questions to gain information, so it again helps to avoid putting your counterpart on the defensive. It also allows them to lead the direction of the conversation. It's much less adversarial if we're allowing them to take the lead and we're following their lead. So, and you can use mirrors repeatedly throughout a conversation. In the early stages of a conversation, they're a great way to gain more understanding, again, get inside the head of your counterpart, and build rapport at the same time. Because as soon as we start demonstrating that we're listening to understand, that will build trust and rapport with the client, at least at an unconscious level. Okay. The next step is to listen. And by listen, we mean listen to understand, not listen to respond. A bit like we're wired to ask closed questions rather than open questions, we are also wired to listen to respond rather than listen to understand. And we're all guilty of it. As we're hearing the information coming in from the other person, we're generating our response. We're thinking about what we're going to say before we've even finished hearing the message, long before we've finished hearing the message. Now, there are three big barriers that make listening to understand really difficult. It is a hard skill and it takes practice. And those 3 barriers are thought speed, courage, and generosity. Now, thought speed is probably the biggest one of all. And that is just simply the way we're wired. We think 4 times faster than speech. So whilst the words are coming out at about 150 a minute, we're thinking at somewhere between 400 and 500 words a minute. So our brains are well ahead of the message being received. So we just need to try and slow that down and fight that feeling of, I know where this is going and I know what I need to add. The second is courage, and that might sound odd. Why would a barrier to listening be courage? And that is because, I go back to what I was saying before, there is your truth and there is their truth in any conflict. And of course, there's a great saying, there is no truth, just versions thereof. And so when it comes to conflict in any context, it means that we really need to leave our ego at the door. We need to come in with a view of curiosity or a mindset of curiosity. In other words, what information does this person have that I'm not privy to? Their perspective is their reality. And it's only through curiously questioning can we possibly understand their position. And the reality is that we might have something to, in fact, we're always going to have something to learn. So we've got to have the courage and the humility to let go or suspend our judgments and be prepared to rethink our position on things. We don't have to change our position, but we've got to be ready to be agile in our thinking and, in fact, rethink and come to a different conclusion. And there's real humility involved with that. And the third is generosity. I mentioned before we tend to ask closed questions. Why? Well, we're busy. Just give me a yes or no so I can move on to the next thing. To really listen to understand, it takes time. The message is not going to be one word. We've got to be generous with our time. listening again to fight thought speed. We need to be generous with our focus and our energy. So there's real generosity required, generosity of spirit, in order to truly listen. And once you have listened, a great way to practice listening to understand, and importantly, demonstrate perspective taking, demonstrate to your counterpart that you do understand their perspective, even though you may not agree with it. You don't have to agree, but it's incredibly important to demonstrate that you understand, is to utilize what's called playback. So ask open questions to get as much information as you can, close questions to, I said, confirm factual information. And then once we've understood, play the message back to your counterpart. And that's as simple as, so if I'm hearing you correctly, what you're saying is, or just to ensure that I do understand and we're aligned here, what you're saying is, and then play back as accurately as you can the message that you heard. Now, if you've got it right, they'll say, yes, that's what I'm saying. They'll confirm. If you've got anything wrong, then they'll recalibrate for you. No, that's not what I'm saying. What I'm saying is, oh, okay, all right. So demonstrate, the label demonstrates empathy, looks like, it seems like, it sounds like, I can see, and then playback demonstrates perspective taking. And they're the two biggest needs of your counterpart, that you understand what they think and you understand how they feel. Okay, then there's the final step, and that is we need to take some action. Now, the action that we need to take will very much depend on the context of the situation. So start by thanking them for raising this with you. If they didn't raise it, there's no way you could do anything about it. So thanks for taking the time to share your perspective here. We certainly couldn't have done anything if you hadn't have done that. And then take ownership. Now, you will find for a lot of clients, when you ask, in terms of next steps, what would you like to see as an outcome here? Open question. What would you like to see as an outcome here? They might say, look, I don't think there's anything further. I'd just like to know that it's been flagged and that this is not going to happen to anybody else. No, thank you so much. We've certainly taken that on board, and we will be reviewing our policies accordingly, as an example. So in a lot of occasions, once people have been heard and feel thoroughly listened to, they'll say, no, that's it. However, some complaints involve a whole raft of moving parts. There can be real complexity to them. So we need to do some inquiry and then come back to them. So would it be a bad idea, or would it be inconvenient? Would it be inappropriate if I took some time to investigate? Because there are a number of moving parts and I can't speak for people that aren't present. So would it be a bad idea, or would it be inconvenient if I took some time to investigate and get back to you? Generally speaking, as long as people know something's happening and we keep them, we have some timeline for them, okay, great. I will be back in touch by. Don't leave it open-ended. Make a commitment. Now, you'll note here I've said, would it be a bad idea if? Or would it be inconvenient? Or would it be inappropriate if? And what I'm asking there is a no-oriented question. So I just want to just touch on this concept that this is extends beyond just taking action with an aggrieved client. We are all wired to ask people for a yes. Could you give me a hand? Do you mind having a look at? And in terms, at an unconscious level, when we ask for a yes, or when a yes is asked of us, it encroaches on our sense of autonomy. Subconsciously, we're asking ourselves, what am I committing to here? We often say yes when we actually mean no. We don't want to say yes at all, but we do. And asking for a no reverses the orientation of the question. And so you achieve agreement with your counterpart enjoying some sense of safety there, that their autonomy is not being encroached upon. So to give you an example here, hey, have you got a minute to catch up? And this could just be with a colleague. We're asking for a yes. Now, when we hear this at a conscious or subconscious level, we're thinking, how long will this minute actually be? Because I know with you, it's never a minute. So what am I actually committing to here? The second question, if I do have a minute, whatever a minute really is, do I really want to spend it talking to you? And it might be just not at this time because of other things I've got going on. And then finally, if I do want to catch up with you, I do have that minute, whatever it is, do I want to talk about what you want to talk about? So when asking for a yes, it starts to raise all these questions, consciously or subconsciously. What am I getting myself into here? If we flip the orientation of the question to ask for a no, people feel quite safe or feel more safe, and you achieve the same result. So a couple of quick examples. Can you please give me a hand for a minute? Would it be impossible to give me a hand for a minute? Would you take over this case for me tomorrow? Are you opposed to taking over this case tomorrow? Do you have a few minutes? Is now a bad time? So we're simply asking for a no to get agreement. And it's just a handy strategy with both confrontational clients in other settings as well. Okay, so that's it. DEALT. D, don't react, build in time for self-regulation, don't accept abuse, use an I message. Number 2, extricate and empathize. Not a spectator sport, don't want to do it in a crowded room. And empathize, use a label. I can see, it looks like, it seems like, it sounds like. Then A, ask good questions. You might have a place for some closed questions, but remember your open questions whilst avoiding why. What makes or what made? Listen to understand, fight that thought speed, be curious and non-judgmental, be ready to rethink, and then finally take some action. And that action will very much depend on the context of the situation. So I am going to stop there, draw breath, hand back to Denise and see if we've got time for questions.
Perfect. Thank you. Any questions, anyone? You can raise your hand at the bottom. Any thoughts on today's webinar? Feel free to share. Or you could put your question in the chat as well, if you're more comfortable with that.
There we go.
Yes,
Christopher raised his hand.
Christopher Riley.
Yeah, you can call me Chris. It's great. Thanks. So,
Hey, Chris.
hi, I'm an Australian in Canada, so if you're wondering what's going on. Just coming back to that emotional response, I found sometimes selectively that's what they need. Like in some situations of difficult conversations, the person feels like they need you to emotionally commit to their situation. Have you had situations like that where sometimes an emotional response is the right response? And when I'm saying emotional, I mean, I'm conveying the emotional response. I don't really feel that, but that's what they need to see.
Yeah. I think as human beings, there's always going to be emotion involved. And remember, there's all of these cues going on that we are oblivious to or relatively unaware of. For example, your facial expression. They can see your face, you can't. Your tone of voice. Everyone's heard their own voice now with modern technology. Everyone's heard their voice in a recording. Hands up who loves the sound of their own voice when they hear it recorded. Like, it's just the worst thing you could possibly hear. Please tell me I don't sound like that. That is because we're actually tone deaf to our own voice. Everyone else can hear us accurately. We can't hear ourselves accurately. So we are conveying emotional information all of the time that we're not even aware of. And we're also, again, through sort of evolutionary biology, we're also very, very good at interpreting body language, facial expression, and so forth, because we're wired to find out friend or foe very quickly. the words you speak may not be true. So I'm constantly looking for other cues that tell me I can trust you or I can't trust you. So we're conveying emotion no matter kind of how controlled. I guess what by don't react, what we're really saying, Chris, is don't go into this in a heightened emotional state where you can't bring your best self into the interaction. So self-regulation, wherever possible, build in time, even if it's just a minute or two, to rest or reflect, rest and reset. But we're going to demonstrate emotion whether we like it or not. Our facial expression will say we're really uncomfortable because we are. I mean, that's just part. Again, hands up who enjoys conflict. Like probably not a single hand will go up. We're not wired for it. So we're going to convey that discomfort automatically. Does that help? Does that help answer the question? Or have I just wandered way off track?
No, that's helpful. And I agree. And I also manipulate my body language too, depending on if there's a lot of conflict or aggression, then I reduce my profile size so that people doesn't feel like I'm threatening them. So you can manipulate your body language too if you're conscious of what he's doing. But
absolutely.
Yeah.
Chris, that's a great point. And an example would be often when someone's kind of in conflict, they'll have very closed body language, arms folded, they're closed down. One of the things that we can do is, as you're suggesting, is using our body language to help manage the situation. So if someone sort of standing there, if I just put my camera down a little bit, someone's standing there like this, they're very closed, I wouldn't fold my arms, but I might start with them. I don't know if you can see that, but kind of like one on top of the other. And I'll stand like that for a little while, and then I'll start to open them up. And what you'll tend to find is your counterpart will likely mimic you, and they'll start to open up also. Yeah.
Gary, there's a question on the chat from Dr. Babalola.
Right. Let me have a look.
How do I interpret the other person's body language while dealing with a quiet but dissatisfied client?
I would say it's a very, very good question. I would say that we are wired to interpret body language, facial expression fairly accurately. So we could probably, without a client saying a word, we can probably tell if they're dissatisfied. There's all these visual cues without even a word being spoken. I guess where we're dealing with a quiet client, this is where questioning is so important. And also if someone's quiet, really taking our energy level down to them. So just sort of taking the volume down, slowing the tempo, and something like, I get the sense that something's really not sitting right for you here. Do you mind sharing what's going on for you right now? So we just want to really try and open them up a little bit. And to whatever they say, we want to ask our next question. Let me just play this out for a minute. So we kind of, I sense that things aren't right for you right now. This isn't sitting well for you. Would you mind sharing sort of what's going on for you? Now, this is hypothetical. Well, I'm really disappointed by the lack of communication from the practice. Your next question needs to be based on that answer. And another open question. What is it about the communication specifically that has disappointed you? That demonstrates that you listened and you're now following that line of inquiry. It's very hard for someone to be quiet if we're asking open questions. I think that's the key there, is open questions. Whatever answer we hear, the next open question is going to be based on the answer that we just heard. And then they're leading the conversation and you're following.
That's great. Thank you. Emily, you had a question?
Awesome. Thanks, Gary, for the presentation. That was great. I just had a bit of a kind of follow-up question for kind of, let's say you've gone through this process and you get to the end or kind of near the kind of take action and you just keep hitting a wall. Like I've definitely had clients where I just can't get through to them no matter kind of what approach I'm taking. And it could be for a variety of reasons. I'm just wondering if there's ever a place for things like maybe taking some time away and trying to revisit it, whether that's bringing someone else in from the team to kind of have a different perspective. Have you ever had kind of situations like that where those kinds of strategies would be helpful?
Yeah, Emily, first of all, it's lovely to meet you and see your face. I know I recorded a video recently that went onto the chat in response to your inquiries. Like, Emily,
Yes,
great
thank you.
question. So it's lovely to see you, first of all. Secondly, could you give me an example? Would there be an example where that you could think of where you kind of like you feel that you're at that impasse?
Yeah, I had a client who this is somewhat recent, who had an kind of middle-aged golden retriever dog and had a bit of dental disease, fairly mild, but had one tooth that I thought was really causing the dog some pain. And we had very differing opinions on whether the dog was in pain or not. And that I think was really the core of the issue. Is I had tried it from a couple different angles, and I think she just felt increasingly like I was either telling her she was wrong or that I was kind of, I felt she had a lot of guilt over maybe not recognizing that her dog was in pain. I find that's often where clients are coming from.
Yeah.
And so we just kind of went around in circles, and I really felt like this dog needed some treatment, and it seemed like she wanted treatment, but I just couldn't get her there. And it just kind of kept escalating to the point where I was like, I basically said to her, I said, I don't feel like there's trust here. I said, what can I do? Is there anything I can do to kind of build that with you? Because I just don't feel like you trust me. And she just didn't really have anything to say past that.
Yeah.
And so I wasn't sure if that was a situation where I should say, hey, let's go away. Let's maybe, book a follow-up. Let's next week when kind of everyone's settled, maybe we can try this again. Is this a situation where you maybe want a second opinion in my practice? Is this where I bring a management team member in? Like, I just wasn't sure how to approach that.
Yeah. Yeah. Emily, great question, because this brings in sort of some elements of patient advocacy as well.
Yeah.
And, we talk about in patient advocacy, in order for a client to buy from us, and I use that word inverted commas, buy, in other words, to get them to a yes, we need to establish two things. One is rapport, they like us, and two is trust. If the client doesn't like us or trust us, then it's unlikely we're going to get them across the line.
Yeah.
Now, remember that you're 50% of this, and you can't control them. You can try and influence, but there's only so much you can do. And that for whatever reason, at least 10 to 20% of your clients are going to say no. And the underlying reason may or may not be clear to you. What's going on inside their heads, we're only going to get so much, what they're willing to reveal. So that would be some basic points, I would say. In conflict, we're not going to change somebody's mind, because what we're really, if the client's position is, my dog is not in pain, this is not painful, taking the approach of, let me tell you why I'm right, and or let me tell you why you're wrong, is not going to change anybody's mind. Mm-hmm. What it's actually going to do is you're going to reinforce their position. If we attack somebody's perspective or position, all we do is reinforce it. They'll then tell you, well, let me tell you, Emily, why I'm right and you're wrong. So the most effective technique to try and stimulate rethinking is to actually ask questions. You know, I hear your sort of, I hear your skepticism around the presence of pain. A couple of things to think about would include, what does a human being look like when they've got dental pain?
Mm-hmm.
They look exactly the same. You'd never know someone had a toothache unless it was extreme with facial swelling. You would never know. People look the same. The only reason the dentist knows there's something's going on is because you sit down and say, I've got a toothache. And then they'll ask, where is it? Because they don't know where it is straight away either. You know, where is it? How does it feel? How long for? So what would a human, what would you or I look like if we had dental pain? We look the same. Another one, maybe extend beyond just one tooth even, but more broadly, one of the things I hear all the time is, oh no, they're not suffering any pain because they're still eating.
Mm-hmm.
Well, what happens if they stop eating? So there's not a direct correlation until an extreme endpoint. It's not a correlation between eating and pain. These are two different things. So asking a couple of questions. What we find is, if there's pain on one side, they'll chew on the other side. So often, if you've got a fracture on one side, often you'll see greater plaque development on that side or greater tartar because they're selectively chewing on the side. So, this raises another question. Like there's definitely asymmetry here. So asking questions. The other thing I would say is we talk about the benefits of doing the procedure. So by doing this procedure, we're going to remove the discomfort and as soon as it's healed up, we restore them to great health. If we don't do this, infection is going to keep getting worse. The bone, let me just show you an X-ray of a similar case. See that sort of black area there, or see that halo? That's where bone of the jaw has been eaten away by chronic bacterial infection. That's what's going to happen in time if we don't act on this. Mm-hmm. And risk aversion is a very powerful motivator for people as well. So with any recommendation, here's the benefit of doing it. Here is the risk, or not just the risk, but here's the reality of not doing it. They would be the two strategies I would be thinking about. Drop some questions to leave them to think about it, and talk about not just the benefit, but the risk or the cost of not doing it.
Okay, awesome. Thank you.
Terrific. The one thing I would say, to draw in another colleague may undermine your credibility.
Okay.
You're the expert in the room.
Right.
So to bring someone else in would worry me. I mean, there are certain contexts like a new graduate where it's perfectly appropriate to say, or even, look, I'm going to bring in one of my colleagues because they're a real expert in cardiology and it's not my strength. So I'm going to bring them in. So there are times when you can build credibility through that, but I think be wary of that context. It's almost like, well, I can't convince you, so I'm going to get this person to try and convince you.
Right.
Could really undermine your credibility as the expert in the room.
Right. And I think I see it more as like, I'm hitting a wall with this person. It feels more, even if I've used all those tactics, I'm not getting through. And sometimes it might just be, I am that 10 to 20% of that time where this just isn't a good match. And there may be someone else who can, suit your needs better than I can.
Yeah. I think the only thing, you may or may not have done a module yet on social styles.
Yeah, we did a little bit on social styles. Yeah.
Okay, so you could definitely utilize where possible social styles to your advantage there as well. Like, it might be that this person is highly analytically minded until you hand over some notes to talk through it.
True.
They can go home and read, and then they're going to jump on Google, and until they do their homework, they're not going to say yes.
Yeah, true.
Whereas an expressive client, you say to an expressive client, I can't wait till this is done. They are going to feel $1 million. Like, it's just going to be so exciting. Like, oh, quick, book it in. Let's do it.
Right.
So yeah, shift your style to suit the client where you
Right.
can.
Yeah. Awesome. Thank you very much.
Pleasure.
Perfect. Thank you, everyone. I want to thank everyone for their participation this evening. I know we went a little bit over the hour mark, but I hope you enjoy the rest of your evening, and we'll see you all very, very soon.
Thanks, everybody.